Building muscle usually requires lifting heavy weights, but what if there was a way to gain strength and size while lifting much lighter loads? Blood flow restriction, BFR, training is an advanced technique that allows athletes, bodybuilders, and even rehabilitation patients to achieve muscle growth without the need for heavy resistance. This video explores the science behind BFR training, how it works, and whether it is the secret to faster muscle growth. What is blood flow restriction, BFR, training? Blood flow restriction training involves using specialized bands or cuffs to partially restrict blood flow to the working muscles during exercise. This method allows individuals to perform strength training with lighter weights, 20–40% of one representative max, while still achieving significant muscle growth. How BFR works. 1. A band or cuff is applied to the upper arms or legs, restricting venous return, the flow of blood out of the muscle, while still allowing arterial flow, blood entering the muscle. 2. The buildup of metabolites such as lactic acid triggers muscle fatigue much faster than traditional lifting. 3. The body responds by increasing muscle protein synthesis and growth hormone release, similar to heavy resistance training. This creates hypertrophy, muscle growth, with much less mechanical stress on the joints and connective tissues. The science behind BFR training studies show that BFR training can stimulate muscle growth comparable to lifting heavy weights, making it an effective tool for various populations. Key benefits of BFR training. 1. Muscle growth with lighter weights. Traditional strength training requires lifting at least 65–85% of one representative max for optimal hypertrophy. BFR allows significant muscle growth with only 20–40% of one representative max, making it ideal for those recovering from injuries or looking to reduce joint stress. 2. Increased growth hormone and anabolic response. BFR training elevates growth hormone levels up to 290%, which enhances muscle recovery and fat metabolism. 3. Reduced joint and tendon stress. Lower loads mean less strain on joints and connective tissues, reducing injury risk. Beneficial for older adults, injured athletes, and rehabilitation patients. 4. Enhanced endurance and recovery. Increases capillary density and oxygen utilization, improving endurance performance. Speeds up muscle repair by increasing blood flow post-exercise. How to perform blood flow restriction training. BFR can be applied to both upper and lower body exercises using specialized bands or wraps. Step-by-step guide to BFR training. 1. Select the right equipment. Use BFR bands or cuffs designed for resistance training. Ensure the pressure is tight enough to restrict venous flow but not arterial flow. 2. Choose the right weight. Use 20–40% of one representative max, 1 RM. Perform higher repetitions, 15–30 reps per set, 3–5 sets per exercise. 3. Control rest periods. Rest for 30–60 seconds between sets. Keep sessions brief, 15–20 minutes per muscle group. 4. Apply BFR bands correctly. Upper body. Place the bands at the top of the arms, near the shoulder. Lower body. Place the bands at the upper thighs. Use a tightness level of 7/10, tight but not painful. 5. Monitor and adjust as needed. If you experience numbness, excessive pain, or coldness in the limb, loosen the bands. Start with 1 to 2 sessions per week, then gradually increase. Who should use BFR training? BFR training is effective for a wide range of individuals, including athletes looking to enhance muscle growth without heavy lifting, injured individuals recovering from joint or tendon injuries, older adults who want to maintain muscle mass with lower resistance, bodybuilders seeking additional hypertrophy benefits, endurance athletes improving muscle endurance and recovery. However, BFR may not be suitable for those with blood clotting disorders, cardiovascular conditions, or high blood pressure. Consulting with a medical professional before starting BFR training is recommended. Does BFR training replace traditional strength training? While BFR is an effective muscle building technique, it does not completely replace heavy strength training for advanced lifters. 1. For beginners or those with injuries, BFR can be a primary training method. 2. For experienced lifters, BFR can be a supplemental tool to enhance growth and recovery. 3. For rehabilitation, BFR is often used to maintain muscle mass while recovering from injuries. A balanced program incorporating both traditional strength training and BFR may offer the best results. Final thoughts. Is BFR training the secret to muscle growth? Blood flow restriction training is an innovative technique that allows individuals to build muscle using lighter weights while still achieving significant hypertrophy. Key takeaways. 1. BFR triggers muscle growth without heavy lifting. 2. It increases growth hormone and reduces joint stress. 3. Effective for rehabilitation, injury prevention, and muscle endurance. 4. Best used alongside traditional training for maximum results. Would you try blood flow restriction training? Share your thoughts in the comments. Subscribe for more fitness and muscle building insights.